Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya eh. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang iniisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Jansen and Mr.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates, so it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really like Simply Nature that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
Hello po, ako nga po pala si Ronaldin Rosales Batalier, 23 years old at ako po ay taga Bicol, Albay. Na-diagnose po ako nung taong 2015, which is ito po yung mixed germ cell tumor sa ovary. Stage 1 po ako nung diagnose ako. Tinanggal po agad yung right ovary ko noon. May nakakita sa akin na taga doon sa amin, sabi niya, what if try ko daw sumali ng contest? Tapos hindi ko nga sinabi na may sakit ako eh. Sabi ko, sige baka sakaling kahit paano may pandagdag kami sa gastos namin. Then noong 2017 po, yun na po, pabalik-balik yung lagnat ko. Siguro mga 2 weeks hindi ako nawawalan ng lagnat. Tapos yun na, pag-check up ko kasi lumaki po yung tiyan ko. Doon ko po nalaman na yung cancer ko daw, numerous to count na siya. Yung sakit sobra pa, yung nararamdaman ko, likod and sa stomach ko. Ganun po lumaki po yung tiyan ko, hirap na hirap po ako. Nagawa po yung nakalata na din yung lungs ko. Yung sa liver ko, kaya daw po lumaki yung tiyan ko, gawa ng sa liver po. Hindi na masyado nagpa-function yung mga organ ko sa loob ng tiyan. Yun po, ni-repair na po kami sa child house. And then, nung start na nag-chemo ako, doon na po kami tumira. Nag-stay na po sa child house. Akala ko okay na, wala na mangyayaring operasyon ulit. Pero nagulat po ako kasi every monthly check-up na lang po ako. Umuwi lang po ako sa amin tapos nagsusuka na naman ako. Akala ko kung ano na naman po yun. Yung dumi, nailalabas ko sa bibig na. Sabi ko, ano na naman to pa? Kaya na naman tayong sisimula na naman tayo. May nakita daw po ulit na bukol sa diaphragm. Iyak na naman po ako. Sabi ko, hindi pa nga magaling yung sa ibang organ ko. Tapos ito na naman. Po as of now, wala na po akong treatment and may tumor pa po ako sa diaphragm. And lately, may nakita na naman daw po sa akin ng gallstone sa may gallbladder ko. Napansin ko po talaga, start po uminom ako ng Simply Nature, which is yung powder and tablet po na PPARs. Para pong, pag nainom ko na po siya before ako matulog, pag nakakainom po ako, parang nare-relieve, parang nare-relax po yung katawan ko. Siguro mga 2 days after na take ko po yung gamot, parang napansin ko na parang everyday na ako nagbabawas. Kasi po talaga dati, siguro sa isang linggo, 3 beses lang po ako nagbabawas. And nakita ko po talaga yung good feedback agad ng gamot na ininom ko. Kasi yun nga po, parang pag nainom ko po siya, parang yung sa loob ko na may something ako naririnig na tumutunog. And after yun po, nagbabawas na po ako. And parang ang gaan po sa pakiramdam. And parang medyo po nabawasan yung bloated ko sa tiyan. Start po nung uminom po ako. About po dito sa PPARs powder po, tinitake ko po siya every after meal. And based sa protocol po na ibigay po sa akin ni Doc Jansen, pag morning, which is 5 scoop, nilalagay po sa ilalim ng dila, and antayin mo po yun matunaw. Pag gabi naman po, tinitake ko siya after dinner, which is 4 scoop naman po siya. Kasi sa protocol po is kailangan everyday makatake ako ng 9 scoop. So, kapag po, based po sa observation ko, kapag po naiinom ko po itong PPARs powder,
Parang yung something na tumutunog po talaga sa tiyan ko na parang may something, parang kini-cleanse na yung sa loob ng tiyan ko. And after po nun, magbabawas na ako. So parang after ko pong magbawas nun, parang feeling ko sobrang gaan ng pakaramdam ko sa tiyan ko. Tungkol naman po sa PPARS Plus tablets naman po, based sa protocol po na ibinigay po sa akin ni Doc Jansen, ano po siya, kailangan everyday makatake po ako ng 30 tablets. So sa protocol po na sinusunod ko, iinumin ko po siya with empty yung stomach ko. Pag morning, pagkagising ko, ito po talaga agad yung iniinom ko. 15 tablets sa morning, and after naman po, same, kailangan empty din yung stomach mo. 15 sa morning, ng pagkagising ko, and 15 sa evening after dinner ko before ako mag-sleep. Kasi, yun nga po, mas pinipili ko siya after dinner na lang po siya inumin para po agad, pag nainom ko po siya, yun nga po, nare-relieve yung katawan ko, parang mabilis po ako nakakatulog, and naiiwasan ko po yung insomnia na lagi ko pong nararanasan noon po, na lalong-lalo na po nung after po ako mag-chemo. So, yun. Daily routine ko, yun, gumigising ako ng umaga for exercise kasi yun din yung advice sa akin ng doktor ko. Kailangan may regular exercise ako and pagkain ng mga masustansyang pagkain. And yun nga po, nabanggit ko last time na mahilig talaga ako magluto. Yun po talaga, kapag kumakain po kami sa office, talagang ako po yung luluto po para sa pagkain po namin ng ibang mga kasamahan ko pasyente. As of now, thankful po ako kasi isa po ako sa nakatanggap ng scholarship sa isang magandang universidad dito sa Manila. Isa po sa nag-udyok sa akin para kumuha ako ng kursong education is yung mga bata po na kasamahan ko dito. So, nakikita ko po yung hirap ng papa ko. So, sinasabi ko sa sarili ko na hindi ako kailangan panghinaan ng loob. Kasi yung papa ko, nilalaban niya ako eh. Pero ako that time po kasi kapag naiisip ko yung taning ko, parang ang sakit po. Like, nakikita ko yung papa ko na lumalaban. Pero yung katawan ko, pakiramdam ko po kasi sumusuko na kahit yung utak ko, yung puso ko gusto ko lumaban. Hindi matutumbasan ng pasasalamat yung nagawa sa akin ng papa ko kasi talaga sobrang bait ng papa ko.
And nung November po is nag-CT scan po ako. Doon ko po nalaman na may nakita daw po na bagong tumor po sa akin. So that time syempre naisip ko na okay na ako tapos may nakita na naman po ulit na bago. So I am so thankful po kasi nung December po is nakilala ko po kayo. Nakilala ko po sila Mr. Shyan, sila Doc Jansen po at ang Simply Nature staff po na alam ko pong nakatulong po talaga sa akin. And yun nga po, nung nakita po na parang bad yung result ng CT scan ko, and after po ng December, after December po, and until June, July, nakatatlong CT scan po ako. At nakita ko po talaga yung improvement po ng result ng CT scan and ultrasound ko po. And I'm so happy po na nitong latest na CT scan ko nung July, tuwang-tuwa po si Doc Jansen kasi talagang nakita po niya na lumiit po talaga yung tumor ko. And masayang-masaya po ako doon. Siguro kung wala yung Simply Nature, siguro yung tumor na nakita po sa akin, I think siguro po mas lalala po siya. Kasi yun nga po ang sabi nila, kapag na-stress yung pasyente, mas lalo po yung nagtitrigger yung cancer po. Kaya yun nga po, maraming salamat po talaga sa Simple Nature kasi kung hindi po dahil sa inyo, siguro hanggang ngayon stop pa rin po ako sa pag-aaral. Ngayon po, gusto ko lamang po pala ipaabot ang aking pasasalamat kila Doc Jansen and Mr. Shyan. Maraming salamat po talaga kasi alam ko po talaga nakatulong po siya sa akin at alam ko pong mas lumakas po ako. And sabi nga po ni Doc Jansen na kahit slowly siya, sure naman po talaga nagagaling po ako. Kaya maraming salamat po sa walang sawang pag-support po sa akin.
Hello, everyone. I'm Sheila, and welcome to another episode of Simply Nature webinar. This program is powered by Simply Nature International and Simply Healed Medical Group. As we commemorate the World Cancer Day tonight, our focus is on breast cancer, a topic close to our hearts, literally, actually. Breast cancer isn't just a disease, it's a shared challenge of every person. And every statistics represent a mother, a sister, a friend, and a real person facing this formidable disease. That is why tonight we explore the curability of the breast cancer and to understand how PPARs can play a role in your healing journey. Tonight's topic is entitled Breast Cancer in 2024. Is it curable now? We appreciate each and every one of you for watching and registering to this webinar and sharing as well this webinar to your fellow friends and loved ones who also suffer from breast cancer. So let's not keep you waiting. Please know that we will be having what we call an AMA or Ask Me Anything portion just after the discussion. So yes, questions are very much welcome. And yes, kahit Tagalog po pwede. So just drop them on the comment section. I'd like to introduce the expert who will lead the AMA portion later after the discussion. Our first expert is a graduate of St. Luke's Medical Center, College of Medicine, and is a diplomat of the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. He is also an integrative medicine doctor, a medical director of Simply Healed Medical Group, and a consultant at Alta Integrative Medicine and Wellness Complex at Perpetual Health, Las Piñas, where he manages patients with cancer and metabolic illnesses. Now, our next expert he is a successful entrepreneur who is also a seasoned international speaker of a wide range of topics from personal success to healthcare. Our CEO and founding director of Simply Nature International, Mr. Shyan Lim. Please watch this.
Good news! Breast cancer is curable. The number one question that runs in the minds of breast cancer patients is, do I really have to undergo mastectomy? Can I avoid it?
Hello everybody, welcome to another episode of Simply Healed. Today we're going to talk about breast cancer again. This is a very hot topic, and the last time Dr. Jansen spoke about it, and there were so many questions from the viewers. We got Dr. Jansen back to talk to us about breast cancer again today. So welcome, Dr. Jansen.
Yeah, glad to be here again. Excited to be discussing again with you.
Yeah, I saw the trailer for today's program, and you made such a strong declaration that I'm sure all the viewers out there are so excited to know more. You said that I saw it in the trailer. You said breast cancer is curable. Wow, that is such a powerful statement. Would you like to elaborate on that? Because I'm sure that gave a lot of hope to all our viewers out there today.
Okay, so yes, breast cancer is curable, especially when it is discovered in the early stages. But even so, when it is discovered during the advanced stages, there are a number of patients can still survive, okay, or have a good survival rate, okay? So first, let's discuss the early stages. What criteria must be met for you to be able to survive breast cancer? Okay, so number one, it shouldn't have spread to other parts of the body, okay? Because if it spreads, then it is more difficult to control. So if it's just localized in your breast, have it removed, okay? Do not be afraid of surgery. Breast cancer surgery nowadays is very safe. You won't lose a lot of blood, okay? Number two, you have to change your risk factors, okay? The number one contributing factor to breast cancer development is lifestyle, okay? Your diet, your physical activity, your stress levels, your sleep. So all of those things put together can contribute to breast cancer or actually prevent you from getting breast cancer. And even if you already have breast cancer, lifestyle can actually reduce the size of tumors, okay? It can alter your genes and actually induce apoptosis to the breast cancer cells. Number three, okay? You have to take action. You have to listen to your oncologists, okay? When the oncologist advises you to go for chemotherapy, please do not be afraid. Now, yes, chemotherapy, if you are afraid of getting chemotherapy, yes, it is valid because there are a lot of patients who get really bad side effects. But the chemotherapy protocols nowadays actually have reduced the side effects significantly already. Okay, I have one patient, breast cancer, stage 4.
Stage 4
bone
breast cancer.
metastasis.
Wow. Bone metastasis.
Bone
That's
metastasis,
difficult.
yes.
Very difficult.
Yeah. If your breast cancer metastasizes to the bone, that is painful.
Yes, the bone cancer is very painful.
Yeah.
Guys.
But you know, this patient of mine can go shopping for at least 30 minutes, a walk for at least 30 minutes. Imagine, walk for at least 30 minutes.
Shopping.
Go shopping. Some patients can't even rise from their bed. Yeah. So, I mean...
What's this patient taking? How come she is doing so well for breast cancer?
Well, at first, she was reluctant to go for chemotherapy.
Okay.
So I tried to convince her. Back then, when I first saw her, she was just in her first cycle of chemotherapy and the side effects were so bad. So I told her straight, you have to go for the chemotherapy. You have to finish it.
So she had very bad side effects for the first cycle.
Yeah. Her appetite was down. Her weight was down. She was fatigued, really fatigued. Okay, but you know, that was one time, and then she stopped. Then we had a conversation. So she is currently now on her 5th cycle of chemotherapy.
Wow.
She had her left breast removed already. So her right breast is still there. 4 tumors on her right breast.
Wow.
2 of them were gone.
Wow.
There's just 2 more small tumors left.
Wow.
Okay, so now her oncologist is actually thinking to go for radiation therapy because it's just two
small tumors.
So it's not gonna be worth it to just...
Is she on PPARs?
Yeah, she's on PPARs. I'm going to go there next now. Okay.
Wow.
Hi guys. Before we continue, I would just like to remind everyone, if you have any questions, just comment them down below and we're going to answer them later in the live Q&A. So the next plan for her would be radiation therapy. But I told her we have to be very, you have to consult, of course, with her radiation oncologist, but we have to be also careful because radiation therapy is a localized treatment. So if you have other
tumors anywhere else,
it's gonna be futile.
Yeah,
so,
not treated, right?
Yeah,
being ignored.
The risk and benefit has to be weighed properly. Okay. And then the next thing is the exciting part is how come she didn't have these side effects? Oh, by the way, she didn't lost her hair.
Wow! Stage 4 cancer, go for 5 cycles of chemo, no hair loss.
No hair loss.
I think because breast cancer, I'm so excited. You can see how excited I am. Because breast cancer is, of course, we always think it's women. And I think, and my wife is a lady, so I can tell you one thing. Whenever hair drops from a lady's head, they are so concerned. It's your... Ladies, I understand, all right? Because I'm a married man. Your hair is your crown of glory. Yeah. So I think that is amazing. No hair loss.
Yeah. I was really amazed as well. So, the chemotherapy protocol nowadays, it's not as what it was before. Okay, so you have to trust your onco, take courage into taking it. Now, what is the key thing here?
What's the key thing?
And by the way, her appetite is also up.
Wow.
Despite taking chemotherapy.
Wow.
She actually gained weight during chemotherapy.
Wow.
She gained 3 kilos. Before I first met her, 44 kilos, now 47 kilos.
Wow.
Okay, so that is...
So what's the key?
The key thing here is you have to follow the prescription of your doctor. You have to change your lifestyle. Okay? And another thing is Simply Nature PPARs. That is also what helped her. Because Simply Nature PPARs actually decreases the side effects of chemotherapy. It preserves the bone marrow integrity. It also preserves your immune system. And make your immune system more hostile to these breast cancer cells. Okay?
Wow. I just did a talk with a group of doctors, and half the talk was on how Simply Nature liquid protects your body from the side effects of chemotherapy. Which is why you will notice, right? We are called Simply Healed. So most people think that when they listen to our program, we will tell them don't take chemotherapy. Yeah. And there will be a lot of our viewers will be kind of surprised. But you know why me and Dr. Jansen, we are not afraid of chemotherapy? Because we know how to keep your hair during chemotherapy. We know how to keep your appetite. That's why we are both more focused on what the chemotherapy can do for you rather than the harm. Because with Simply Nature Liquid, we have found a way to remove the harm so that you get more of the benefit and very little of the harm. And that means that your chance of success in cancer is much higher. And that's what, as a doctor, Dr. Jansen always wants. And for me, my dad is a 2-time cancer survivor, so that's also what's in our hearts. So, wow, very exciting. Thank you, Doc.
Hi everyone, thank you for joining us today. If you want to have a consultation with me, just comment down below and our team will get back to you to set an appointment with me.
So I hope our listeners hear the very important key message here is that don't wait, right? If you feel a lump, it's still small. So if you act immediately, give Dr. Jansen a call, or you give your doctor a call, and you make a quick diagnosis, then you don't need to remove your whole breast. You can do a
Lumpectomy.
Right? You can just remove that portion because you caught it early. So again, don't wait, don't procrastinate, don't say wait till next week, or that maybe it's not a lump, Don't say all those things. If you feel something, if you suspect anything, take action immediately, because that will save your breast.
Yes. And that will also save your life.
Your life. Hallelujah.
Yes, okay.
I was very encouraged. I didn't expect that stage 4 breast cancer testimony. That's really amazing. Stage 4.
Stage 4. Yeah.
Metastasized to the bone.
Yeah.
To the viewers out there, especially those of you who are not so familiar with cancer, once it goes to the bones, it's very painful. It's very difficult to treat. But yet the patient is doing well. Yeah.
I was personally amazed as well.
So our Simply Nature Liquid PPARs is really pretty amazing.
Yeah.
It really is.
That is the one that I prescribed her during the chemotherapy sessions. Simply Nature Liquid PPARs.
Wow.
Microalgae is food, so I mean, it's just you eating the stuff, right? So there's no harm in
So
eating it.
go for your mammogram. Buy 1 bottle of PPAR tablets the week that you are doing mammogram. Just eat more of it. Because just be safe. Right?
But if radiation exposure is a concern for you, the mammogram schedule of once a year is the safe.
It's safe.
It's the safe amount of mammogram that you can receive. So it's the best of both worlds.
Okay.
It's when you get the best benefit
with the lowest risk.
Yeah. And what's more important is the food that you eat, because that has a lot more influence in you increasing your risk or decreasing your risk for breast cancer.
All right, Doc, I think you've answered the key 2 things you promised in your trailer. Breast cancer is curable. Early stages, stage 1, and maybe even stage 2, it's so curable. Your chance of success is so high. And thank you for sharing with us a patient who is stage 4. It's like the worst, for the viewers out there, it's like really the worst combination, to be stage 4 and metastasized to the bone. And Dr. Jansen shared that the patient went for chemotherapy. And again, it's not a rosy story. The first cycle was very terrible for the patient. She wanted to give up. Dr. Jansen persuaded her, stay on course, right? And she went on was it the liquid or the powder?
It was the liquid.
Oh, she went on the liquid. And then after that, no hair loss after 5 cycles of chemotherapy. And shopping for 30 minutes, even though she has cancer metastasized to the bone. Wow.
The thing that I'm more concerned for is getting COVID.
Okay. And her tumors have been reduced, right?
Yeah, tumors have been reduced, definitely.
Wow. So she is in a good position to recover, even though stage 4 metastasized to the bone. I think with that, I just want to stop that, Doc, because I think that is the most encouraging thing. If that can happen for a patient, I'm sure your condition can be cured, all right?
Hi everyone, thank you for joining us today. If you want to have a consultation with me, just comment down below and our team will get back to you to set an appointment with me.
All right, so thank you. We will now move to our live Q&A. Thank you everyone, and do tune in and please share this video, all right? Before we go Q&A, please share this video with other friends and loved ones. I think this topic is so meaningful to all the ladies in our lives. So please share. All right, thank you, Dr. Jansen. Let's go to our Q&A.
Right. See
All
you
right.
at Q&A.
Good evening once again. Thank you so much for watching our discussion for tonight. We are now in the Q&A, or what we call AMA portion. And just before we start off, I just want to greet, of course, our avid viewers out there and also our new viewers of this webinar. Let's not keep you waiting and start off the Q&A portion or AMA portion with our expert for tonight. Let's call on once again Dr. Jansen to answer all our questions. There you go. Hi, Doc Jansen. Good evening.
Hi, Sheila. Hello, everyone. Good evening. Happy to be here.
Yes, Doc. As much as Sir Shyan would like to join us tonight, he has a very important appointment that he has to attend to. So sayang. We have so many viewers tonight, and I can see a lot of questions are coming in. All right, so shall we start? Okay. All right, so for our first question tonight, okay. Coming from Ms. Gaudentia de Villa, is there any vaccination in the prevention of breast cancer?
Oh, unfortunately, we do not have a vaccine developed yet for prevention of breast cancer. Vaccines, no, is only used for infectious diseases. So since breast cancer is not the reason of breast cancer, no, or acquisition or of breast cancer is not related to infection, so we cannot actually vaccinate against breast cancer. However, there are vaccines that are in development nowadays, similar to the mRNA vaccine of COVID-19 that is being developed for breast cancer. So now the vaccine will be used as a treatment instead of prevention. So that's in the pipeline, actually. Okay, so that's still under development, under research.
That's very encouraging, Doc. What a good way to start. All right, another question coming from Ms. Gian Ann Del Rosario. When is the best time to do mammogram? Since I am high risk of having it since my mother was diagnosed with breast cancer at the age of 47.
Very good question. So since your mother is a first-degree relative and she was diagnosed with breast cancer at 47 years of age, then you have to undergo screening 10 years earlier. Okay, so in your case, it should start by age 37. Okay, 10 years early. So what if, no, hypothetically, what if the mom was diagnosed with breast cancer by age 32, no? For example, 32 years of age. So how about you? No, when should you start undergoing screening for breast cancer? Okay? You should start screening by the age of 30. 30. So no sooner than age 30. Okay? So 30 years old is the youngest age that you can begin screening for high risk of or breast or for a strong family history of breast cancer. Okay.
Okay, thank you, Doc. All right, and of course, the percentage of you having it also depends on the lifestyle that you have, right? Okay. Okay. All right. Next question coming from Ms. Joanna Lino. After treatment, how many years to say that you are cancer-free?
Again, a very good question. Okay, so let's break it down. Let's break down the question. So the question is, after treatment, how many years that you're cancer-free? So we have two important concepts here. So being cancer-free, is there such a thing even, no? And after how many years, no, post-treatment? So let's start first with the definition of being cancer-free. Okay, being cancer-free is when you don't have any symptoms of cancer anymore. The tumor is not in your body anymore. Okay, and the chance of recurrence is 0. Okay, so that is being cured or being cancer-free. Now, in actuality, if you really think about it, there's no such thing as cancer-free. Okay, why? Because we always have inside our body circulating cancer cells. It just so happens that they don't form tumors. It's because our immune system are able to kill them off. Okay. However,
let's talk about the context of having cancer already to begin with, no? So if you have cancer already, then you go into remission, no? So by remission, it means that you're free of symptoms, you don't have any evidence of cancer left in your body, or the cancer is not growing anymore. You still have the tumor, but it's not growing or it's not worsening. Okay. So after 5 years, no, and it's still the same, then you are considered as cured already or cancer free already. Okay, that's just the definition that the researchers were able to or the researchers set. Okay, so how soon? How soon can we say that someone is in remission? It's 1 month post treatment. Okay, so 1 month post treatment, if the patient has no symptoms already or the evidence of the cancer is none, okay, there's no evidence anymore, then the patient is already considered in remission. 1 month post treatment.
Okay. One remission. Oh, there you go. Thank you, Dr. Jansen. That's very clear, huh? Okay. Another question coming from Miss Myra Mata of Las Piñas. At the age of 38, should I undergo breast ultrasound, even no symptoms? Can a breast cancer survivor of 5 years can plan to pursue pregnancy? And is it safe to have a child?
Yeah, so we go back to the concept of screening, no? Now we have to know, since you don't have any symptoms, then we have to know your family history, your genetic predisposition as well. So number one, do you have a strong family history of breast cancer? By strong family history, this means first degree relative. So either a sister, your mom, no? If so, kung totoo yun, no, there is your mom has cancer, yung breast cancer, or your sister has breast cancer, then 10 years early. So depende na yun kung kailan madadiagnose ng breast cancer yung relative, no? And you subtract 10 from that. Now, if you are someone who have had radiation therapy on your chest before, then by age 25, you have to begin already. All others by age 45. Okay? All others by age 45. If you have BRCA mutation, okay? Paano kung may genetic?
Okay.
So naputol, okay. But if you have a genetic problem, not genetic predisposition, BRCA, that's the exception to the rule. Kasi by age 25, you have to begin screening already for this. Okay, kasi if you have this genetic mutation, then super taas talaga ng probability that you will acquire breast cancer later on in life.
Doc, just a follow-up question. To begin with, what is the best modality to check or to start off screening yourself? Is it the mammogram, or is it just ultrasound will do?
Yeah, also a very good question. Kasi yung iba nag-breast ultrasound lang, yung iba mammogram combination, yung iba natatakot because of the mammogram. So it's always best to combine. Okay, a mammogram plus an ultrasound. Okay, so that's a more accurate test. So how often? For ultrasound, you can do it once every 6 months kung merong nakitang kung may findings, no? Kung normal naman, there's no findings, then you can do it annually. For mammogram, it's annual. Yeah.
I see.
Okay?
Thank you,
So,
Doc.
let's go to the next question. Yung second question from Myra. Ano nga yun? Breast cancer survivor of 5 years, no?
Okay.
Planning to pursue pregnancy. Yeah.
Yes.
Yes. Yeah, it's safe. It's safe for the child. No problem, no? If you are a breast cancer survivor, no, 5 years na, you're in remission, of course you can pursue pregnancy. If you have had no hormone treatment, chemotherapy treatment before, it will not affect the health of the baby. So, yes, you can.
Even the lactation is safe. Correct, Doc.
Yes, the lactation is safe since
okay.
you are
If
you're breastfeeding, no problem kasi you're not getting treated anymore. You're not undergoing treatment anymore. So you're perfectly okay. It's as if you're a normal person. It just so happened you got pregnant, no? So no problem.
I see. That's good to hear. Thank you, Doc. Doc, just before we go to our next question, I just want to invite everybody. Yeah, as you know, we have an upcoming, very exciting event this coming March 16 at SMX SM Aura. Right, I'd like to invite everybody, and just for you to have an idea of what has happened during our last SMX event and what will happen this coming March 16, I'd like you to please watch.
Hi, this is Shyan, and I'm here to update you with a quick teaser. October 14th of 2023, we had our very first post-pandemic face-to-face conference on cancer, and it was a smash hit. The participants loved the ability to ask our panelists of myself, Dr. Jansen, our expert in lifestyle medicine, and Dr. Jimmy Katapia, who's our oncological surgeon. They were able to get all the answers they wanted about cancer and whether or not to go for surgery. So we are planning in 2024 another session by popular demand because everyone wanted us to have another one so that they can bring their friends. So a quick teaser, we're going to have back Dr. Jansen, Dr. Jimmy Katapia, so all of you with questions on chemotherapy, on surgery, the doctors and the panelists are there to answer your question. And we have an upcoming special guest. We are hoping to get someone who is going to be an expert on diagnosis, something as very interesting like liquid biopsy, all right? So that's something new and on the cutting edge of cancer diagnostics. So those of you who could not make it for our face-to-face, well, this time round in 2024 on March 16th, we're gonna do ours with a Zoom option. So those of you who are in the province who can't join us here in Metro Manila, look out for the details so that you can join us on the Zoom cast.
There's a miracle in this simple nature.
Marami po akong natutunan dito sa seminar na ito.
I would recommend it to people who have illnesses, even cancer.
We are always with you from start to healing.
So please, guys, seats are very limited. So as early as now, do get or book your tickets today. Okay. Now, at this point, for those of you who wish to have a consult with Dr. Jansen Kalala, I've seen how he does his consults. He's very meticulous. Okay. If you wish to have a consult, please just type down how to consult or the link on how you can set an appointment for a consultation with Dr. Jansen is in the description box. Okay. All right. Now, on to our next question coming from Ms. Amabel Cal from Lanao del Norte. She has stage 2 breast cancer, done operation last April, but there is a residue of cyst in her underarm or underpit, but which is growing. Doc, anong gagawin ko? What should I do?
Okay, so just to give you some context, no, patient stage 2B breast cancer. What does stage 2B mean? So stage 2B means the tumor is sufficiently may size requirement and there's a lymph node involved in the axillary area or the armpit. Okay. Now for the patient's case, she underwent the operation. However, there is a growing mass in her armpit area. So that mass is what? It's a lymph node that is growing. Now, if this is something that is growing, then that is most likely cancer. Okay? For the patient, no, advice is you have to have this removed. Okay, I think that would be the best best approach. However, if your surgeon does not want to remove this, doesn't want to operate on this, no, then you have to undergo systemic treatment, either chemotherapy, hormone therapy, or targeted therapy. Okay, whichever treatment would be applicable for you. All right, but systemic treatment would be important at this point in time. Okay, because apparently there's a residual tumor. Okay, yeah.
Okay, so definitely, Doc, for this instance, most probably the lymph node that is growing is really just connected to the breast cancer before. And this is this also because, or is it also the reason why a lot of instances after surgery, patients are needed to undergo chemotherapy as well?
Yes, correct. So after surgery, it's always important that you undergo either a systemic treatment or uh, local treatment or localized treatment like radiation therapy. I've seen a lot of patients, no, even when I was still an intern rotating in the radiation oncology department of St. Luke's, no. But we've seen a lot, no, patients who have recurrence because they did not pursue radiation therapy or chemotherapy because they're already confident that the surgeon was able to completely remove everything, no, all the tumors. Now, that is physical. Well, how should I say? It is impossible to, or not impossible, no, but it is highly probable that there will always be microscopic cancer cells that that gets left, no, in the surgical bed. So this is the main reason why we have to undergo chemotherapy or radiation therapy for that matter, no, to eradicate the microscopic cancer cells that was left after the surgery. So of course, no, these are microscopic and the surgeon won't be able to see them. And of course, during surgery, there is some degree of manipulation. So cancer cells would be thrown here and there. All right. So this is one reason why we see recurrences post surgery. However, for that matter, no, it seems like we're demonizing surgery. No, okay? Surgery is the most important treatment, cancer treatment nowadays. Why? Because you remove the headquarters of the cancer. If the headquarters is there, if the tumor burden is cut off, then the probability of metastasis decreases significantly and your survival increases significantly. Nowadays the survival rate for breast cancer is more than 90%. 5-year survival rate, okay? Prostate cancer, colorectal cancer, same. Okay? The main reason is because of surgery. Okay? So please, if you have a tumor, no, please go see your surgeon, consult if it's possible, if it's still small enough, no, that your surgeon can remove the tumor, please do so. Please have it removed. Okay? Yeah.
Thank you, Doc. Yeah, I can vividly remember what you said previously, that if a patient has undergone surgery, she is actually in a very good position to really fight back and go all the way, right? There you go. Thank you, Doc. All right, another question coming from Ms. Liza Demin from Iligan. Can PCOS be connected or can cause breast cancer?
For PCOS, no. PCOS is not a risk factor for developing breast cancer. So you won't. Rest assured. If you do have PCOS and you at the same time you develop breast cancer, then there's a different reason why you develop breast cancer.
Okay, that's still good news. Okay. All right, coming from Ms. Lazaida Moreto. Having a breast cancer stage 1, is it possible without surgery or any other option?
Well, stage 1, well, there's still time, so you can attempt. There are actually a lot of patients who attempt to do so. Not having to not undergoing surgery. They usually go for natural treatments. Well, there is a possibility that you can recover from this since it's still in stage 1. However, if you really want to be sure, so in other words, in Tagalog, no, kung gusto mo maging sigurista, I suggest have it removed, no? But well, would there be would you how's the term? Um would you have the no, not privilege, eh. But yeah, if you will consider other treatments, no, would there still be time? Yes, there would still be time. Okay, because it's still in stage 1, so there's still time to explore. However, since it's cancer, no, I suggest don't explore. Immediately do everything in your power to remove this. Okay, kasi of course, if it worsen, then that's when headache come in. Headaches in terms of, financially, emotionally, physically. Of course, you don't want that to happen.
Exactly. Thank you, Doc. Yeah, because it was clearly said here that it's stage 1. So definitely biopsy has already been done. So it's been already we call it touch, kumbaga, nagalaw na, kumbaga. Okay, thank you, Doc. All right, coming from Miss Nerissa Peralta. Can you breastfeed when you have breast cancer? I think that you answered this a while ago.
Yeah. But however, no, there's a but. There's a but, okay?
Mhm.
If it is painful, don't. If there's no milk being produced, don't. Okay. If there's blood, don't. Okay. Um, yeah, if it's only breastfeed if it's comfortable enough. Okay. But my advice is, if as much as possible, don't breastfeed on the breast that has a tumor. Okay, kasi more often than not, it might um it might be too uncomfortable. Okay, but that's the main
Mm.
reason. But however, as long as your breast or the breast, no, on the afflicted breast doesn't have any discharge, doesn't have any wound, then it's fine.
I see. A while ago, Doc, because the question a while ago is, can you conceive after you got treated or if you're already cancer-free? But this time kasi, no, the question is while you are having that breast cancer. So it's possible to conceive even if you have breast cancer?
Yes, it's possible to conceive even if you have breast cancer. I have handled patients who are in their 30s, diagnosed with stage 4 breast cancer, and they still have a 4-year-old kid. Imagine.
Mm.
So that
Okay.
is quite a heavy burden to carry, actually. So
It is. It
yeah,
is.
it happens actually, but yeah, it's a very unfortunate, no. It's a very heavy burden to carry for the parents, kasi syempre the wife or the mother has stage 4 breast cancer, so the husband is taking care of the wife. Then also both of them would think about their 4-year-old kid, and
Mhm.
most the most anxious part there is the wife may most likely will not see her kid grow up. So that's
Mhm.
quite sad. But yeah,
Mhm.
there are cases that it happens. So even if you have cancer, yeah, you can still get pregnant.
Possibility. All right. Thank you, Doc. Okay. Another interesting question coming from Mr. Archie Hoxon. Doc, in layman's term, what is apoptosis and autophagy? What is the difference? And is there any correlation of PPARs with apoptosis and autophagy?
Yeah, okay. So Archie Hoxon is one of my very good patients, no?
Vision.
Um, Apoptosis and autophagy. Apoptosis is the medical term for cell death. So it's just plainly cell death, no? Autophagy is when cells recycle dead cells. Did I make sense? So, for example, no, cell A and cell B. Now, say for example, cell B underwent, cell B died, for example. So, nag-apoptosis si cell B.
Mhm.
Basically, cell death, no? So, upon dying, of course, cell B, the cells would break down. Okay, so upon breaking down, there will be fragments, cellular fragments. Okay, now
Mhm.
autophagy is when cell A consumes or reuses the parts of cell B. That's autophagy. Okay? PPAR
Oh, okay.
agonists can do that, can stimulate our body to, or it can induce cancer cells to undergo apoptosis. PPAR agonists, no, like the product of Simply Nature PPARs. Simply Nature PPARs is made from microalgae. So there are studies that
Mhm.
it can do that. And of course, autophagy. Autophagy again is when cells recycles dead cells or the parts of dead cells. So PPARs, while PPARs doesn't have a direct influence on autophagy, but it can help healthy cells function better to recycle old
Mm.
cells much faster. Okay, so there is that connection. So it's really possible. And by the way, autophagy, you can actually activate that by
Mhm.
fasting.
Oh, okay. But with this autophagy, doc, the recycling part, the only part or the only fragment that we are taking in to recycle are those healthy parts, the good parts only, correct?
Not necessarily good or bad part. The entire cell would be dissolved and the individual parts
Mm,
will be recycled. So even the bad parts can get recycled into becoming good again. So that's
I
basically
see.
recycling, no? So that's autophagy. So it can
Very good.
happen, yeah. Mhm.
I like his question because I think your patient Archie is trying to help his fellow patients in the community, right? That's why he wants you to explain this part. Thank you, Sir Archie. Okay, next question coming from Miss Josephine Chua. Can breast cancer patients also take medium chain triglycerides from coconut oil aside from PPARs, of course? Thank you.
Okay, medium chain triglycerides is fine. However, here's the thing, no? Avoid saturated fat intake. Kasi saturated fat is the fat that increases insulin resistance. It's also the same fat that induces metastasis. So we do not want saturated fat. Omega 6s actually. Okay? So if it's from coconut oil kasi it's very high in saturated fat. So I always advise patients not to consume coconut oil. Okay?
Mm.
I've had a lot of patients, pero this is non-cancer. Um, yeah, sobrang tigas ng ulo. We're on medications, multiple medications already. The patient is on a plant-based diet, by the way, yeah. But the
Mhm.
patient consumes 6 teaspoons of coconut oil every day. So we have
That's a
difficulty
lot.
in lowering his triglyceride level. Tapos he remains diabetic
Mm.
for a very long time already. So by that time, I expect na ano na siya nag-improve na sana. Kaso nga lang, matigas ang ulo, coconut oil champion. So cannot yan yung unfortunate doon, no? So my advice is if the coconut oil that you're consuming has very high saturated fat content, again saturated fat content, okay, avoid, don't. So for me, for cancer patients, yes, you can consume oil pero extra virgin olive oil dapat, okay? So increase the omega 3s, reduce the omega 6.
Sure.
Saturated fats are omega 6 fatty acids.
Ah, that's a new learning for me today. Thank you, Doc. Okay. Coming from Miss Tess Bautista. Stage 1 invasive ductal carcinoma, triple negative cancer, had mastectomy and chemo done. What product do you recommend to take and required dosage? Also had bad fall last December 2023, had lumbar compression recovering slowly, have high blood maintenance and uric acid maintenance. Doc, consult.
Oh, yeah. I
Okay.
have to I have to talk to you I have to talk to you to get more details. But probably right now what you can take tablets basic, no? Yun na lang muna, tablets lang muna, PPARS tablets. Kasi that will immediately give you some benefit with regards to your hypertension and of course your uric acid. However, I am more concerned about your lumbar compression kasi this is actually very painful. We can use prolozone, ozone therapy for that to manage the pain. And also, kung may if there's still a fracture, no, we can use vitamin D therapy for that. Yeah, I'm actually more concerned about itong fall, no, rather than kaysa yung yung cancer kasi the cancer was stage 1 tapos na mastectomy naman, chemo done. So more often than not, kapag kaganyan, stage 1 cancer, tapos chemotherapy and surgery done, usually they go into complete remission, no problem eh.
Good. That's good to
Complete
hear.
remission means no evidence of cancer at all. And that's after 5 years.
Mm, that's good to hear. This is what happens when you really go all the way in treating your cancer, even just on a lower stage pala. Okay, that's good to hear. Thank you, Doc. For Miss Tess, please, I guess Miss Beth, okay, of SMG can get directly contact you for you to have a consult with Doc Jansen. Thank you, thank you. All right, another question coming from Miss Ellen Habacon. Need advice on foods to avoid when you have breast cancer or you are breast cancer patient.
Okay, better to go for a consult so we can be more specific, no? But Right now, what you can do is, for cancer, no, for cancer, ang dietary recommendation is always eat plants. Okay, food sourced from plants, nothing from animals. Okay, so what do I mean by this? So the foods that you should be eating should only center around vegetables, beans, nuts, seeds, whole grains, a little bit of fruit, no. And on the other hand, what you have to avoid or limit are meat products, red meat, white meat. By white meat, that includes fish and chicken. Okay, fish and chicken. All right, I repeat, no. Another one would be eggs. You have to eliminate that. Of course, dairy products. No, aside from those, even processed foods, no, especially processed meat. Avoid consuming those food items because those food items will promote tumor growth. So what you should be eating again should only be plant foods.
Doc, you mentioned that, and you also mentioned that previously, but we have patients asking, how about organic egg and native chicken? Still, right?
Still, because your body doesn't know if this is organic or if this is native. Parang kung pag ano pala, pag native, ano, no, pwede, pag foreign, bawal. So, no,
So it's
kidding
also
aside,
prohibited.
your body won't be able to recognize such. So, as long as it's animal protein, yun, mag-grow siya. So, by animal protein, no, I don't know if you realize this, there are certain amino acids that you should not be consuming. Oo. Okay? Because there are amino acids unique to animals. Okay? I don't know kung may naka-realize nito in our audience, but the amino acids, no, that you should be avoiding, number one, methionine. So if you are someone na so you check the supplements that you're taking. If there's methionine,
Oh.
branch chain amino acids, yung leucine, isoleucine, tsaka valine. Yan, okay? Those amino acids can make tumors grow. Ano pa? Glutamine, okay? So be careful of those amino acids, no? So again, if you are someone who has cancer, you're taking supplements, especially supplements with amino acids, double check the ingredients list, no? If there are amino acids na nandoon that I have mentioned, okay, avoid taking them. Better replace them. Okay?
Okay.
Because those amino acids are actually unique to animal food, animal protein, and that's one of the reasons why we tend to shy away from animal food products when you are diagnosed with cancer.
That's very, very helpful, Doc. Thank you. Okay. All right. Coming from Miss Helen Sabadera. Okay, her concern is on the prevention side. What are the ways to prevent breast cancer?
Okay, so na-mention ko na, number one, nutrition, go plant-based, no? But if you want to try to prevent cancer, then plant predominant would be enough. Okay, so just avoid consuming foods that are carcinogenic, like processed meat, dairy products, no, especially for women. Basically, yun lang naman. Okay. Now, of course, no, on the other aspects of your lifestyle, you have to exercise. Okay. If you are sedentary, your chance of dying from cancer increases by 2 times. Okay, more than 100% increase actually yan. And if you are sedentary, your risk of developing other types of cancer aside from breast, no, also increases. Like what? Lung cancer, colorectal cancer, endometrial cancer. Okay, so please watch out, no. And of course, sleep, no. Make sure you're sleeping 7 to 8 hours every night. Okay, kasi if you're sleep deprived, sleep deprivation is also correlated with lots of cancer. So number one dyan is breast cancer. Another one is prostate cancer. Followed by colorectal cancer. Leukemia as well, no? Tumataas din yung risk. And of course, lung cancer. Okay? So, lastly, ito, common sense na I think, no, vices, no? Smoking, tsaka alcoholic beverage drinking. So, try to avoid these doing these things. Okay, so if you are able to do so, then chances are you would be able to prevent cancer. Okay, chances are, this is not sure. Okay, because you can just lower the chance or the risk.
Possibility.
Okay, not totally eliminate. Okay, if you want to eliminate your chance of getting breast cancer, then undergo mastectomy. Have both of your breasts removed. Okay, so that's the only way. Okay.
Thank you, Doc. I like the question because this is in the perspective of prevention. So if you know that you are in that in that path, then might away lumihis na kayo or stray away from that path na. Okay, coming from Miss Jen Chan Ang. Okay. Aside from mammogram, is there other tests like blood tests to diagnose breast cancer or any other cancer?
Very good question again. We have nowadays what we call a liquid biopsy. Yes, so it's possible.
Yes, Doc.
It's possible. It's possible, no? However, the role of liquid biopsy has to be put into context. Kasi, say for example, you're perfectly healthy, you just want to be screened, no? Liquid bio liquid biopsy will not be able to detect tumor cells right then and there. Okay? Kasi baka chances are baka magkaroon ng false positive na test result.
There
So,
you
instead of trying to detect kung may cancer ba, screen for it. Okay? Find out if you have genes that or that predisposes you to develop breast cancer. Liquid biopsy can do that because liquid biopsy is a DNA analysis, genetic analysis siya. DNA analysis test. So if the test analyzes your DNA, tapos tingnan ko ano doon yung mga genes na meron ka that predisposes you to develop cancer. Okay? Now, what if you already have a tumor? So may breast cancer na, for example. Tapos you underwent treatment already, tapos nag-mastectomy na, nag-chemotherapy na, nag-radiation therapy na. Say for example, you're also on hormone therapy, tapos you're taking lots of supplements like Simply Nature Peppers, yung iba ng mga mushroom supplements, etc. No? Now, you want to find out if you have recurrence, then that is when liquid biopsy would be valuable because liquid biopsy can detect what diagnostic imaging modalities cannot. Okay, so say for example, PET scans, CT scans with contrast, although these scans are highly accurate, no, they can detect even a millimeter. Okay, liquid biopsy can detect circulating tumor cells. So even when they are not yet detected sa imaging studies, liquid biopsy can show you already na, hey, mataas yung circulating tumor cells ng patient, more or less baka may residual siya somewhere. So it's very important at this point in time to reconsider treatment, for example. Okay? Yeah, that's the value of liquid biopsy.
Angeles. Yeah, that's why it's a very, very good question. Thank you, Miss Jen. Okay, another question coming from Miss Paloma Baez. Does stage 2A needs chemotherapy and also does biopsy result on this needs ERPR and HER2 test?
Okay. So ganito, no? Stage 2A, yes. I highly suggest undergo chemo if your onco recommends it. So may but doon, no, if your onco recommends it because for breast cancer, no, chemotherapy is not the first line treatment anymore. We usually recommend other treatment modalities first, last yung chemo. Okay? So look into those with your explore with your oncologist regarding that. Now, doon sa biopsy result, tsaka yung ERPR HER2, magkaiba yon, okay? So this is how it is different. When a doctor biopsies you, no, kukuha ng laman, okay? So pagkakuha ng laman, they send it to the laboratory. Then the pathologist look at it under the microscope and see kung anong klaseng breast cancer ito. Right then and there, hindi pa nila malalaman kung ER, PR, or HER2 positive, negative. Okay? Kasi they just what? What did they did? They just looked at it, they just looked at the sample under the microscope. ER, PR, and HER2 are staining tests, no? Immunohistochemical staining tests yan. So, if for during the first examination of the pathologist and nakita niya, okay, this is most likely breast cancer, then the pathologist will recommend for the patient to undergo immunohistochemical staining, no, ER, PR, and HER2. Just to know ano yung value nito. To know what treatment would be applicable for you. What treatment would fit you. Kasi kapag ER/PR negative, no, ER/PR is estrogen receptor, progesterone receptor. If you're positive for this, then hormone therapy will work for you. Okay? Kapag negative naman, then it means that hormone therapy will not work. So ano yung hormone therapy examples? Medications for hormone therapy, that would be your tamoxifen, letrozole, anastrozole, ectemistane, yan ang mga hormone, fulvestrant as well, no? Yan yung mga hormone, mga meds, no, used for hormone therapy. Okay, so if ERPR is negative, these medications that I have mentioned will not work. So other medications would have to be considered. Paano naman ngayon kung HER2? Ano ba tong HER2? HER2 is a receptor din, no, found on breast cancer cells, no. Kapag usually pag positive ito, the breast cancer is very aggressive. The prognosis is usually not good if it is left untreated. Okay, kasi aggressive siya. So if positive for HER2, then you will have to get trastuzumab therapy, trastuzumab treatment. Trastuzumab is the specific medication that targets HER2 positive breast cancer cells. So by the word target, trastuzumab is targeted therapy. Okay? So if you're HER2 positive, then trastuzumab will work. If you're HER2 negative, trastuzumab will not work. Okay? So that's the reason behind testing for ER, PR, HER2. Okay?
Grabe, we are learning so much tonight, Doc. Thank you so much. And now I fully understand why you shouldn't stop after finding out that you have breast cysts. That you have to go further to understand what exactly are you fighting, so that the treatment, of course, will be also matched with that. Oh, okay. All right, thank you, Doc. Okay, another question. We are answering so many questions tonight. Yes. Okay, coming from Miss Joanna Kamhit. Is sugar a food for cancer?
Yes, sugar is a food for cancer. Cancer cells consume lots and lots of sugar. Highly metabolic yan sila. So, you as cancer patients, no, you should not consume foods that are very high in sugar. Okay, so processed carbohydrates are an example. Ano yung mga example ng processed carbohydrates? Okay, yan. Wag na tayo lumayo, no? White rice. Okay? Another one is bread. Taas din sa sugar yan. Of course, pastries, your sweetened beverages like your soda, yan, okay? Avoid those foods. So, yung mga honey, kasi masyadong matamis. So, instead, what you should be looking for are foods that is high in fiber. Okay? So, that's the way to approach things.
Okay, thank you, Doc. Very helpful. Another question coming from Ms. Eden Atorne. I just completed my 6th chemotherapy. However, I am HER2 positive and still ongoing for targeted treatment. 11 more treatments. I am still experiencing chemo side effects like naluluha ang mata, my pains on my fingernails, and slight edema. Can I take PPARs to decrease the chemo side effects? Thanks.
Yes, we can try, no? I suggest you go for a consult kasi hindi lang PPARs ang kailangan dyan. But right then and right now, no, what ang naisip ko for this would be, of course, PPARs. What kind of PPAR product should you need? I need more information pa kasi you're still undergoing targeted therapy. Yeah, I have to know what kind of medication you're undergoing kung trastuzumab and what kind of combination ng trastuzumab. Because there are various, no, combination therapy using trastuzumab. But hopefully, soft gel would be enough. Hopefully, no? So, another treatment that I can think of is ozone therapy and vitamin C, drips. Okay? Immune drip ang tawag. Okay? But ozone therapy, I think, would be really helpful for you. Those are the 3 that I am thinking that might be helpful. Okay? So, please schedule a consult so we can discuss further. Okay?
Yes. Thank you, Doc. All right, that's Miss Eden Atorne. All right, our secretary, of course, will be getting in touch with you. Okay? All right, another question from Miss Signation. Hello po, Doc. Makakatulong po ba ang PPARS Plus to prevent breast cancer?
Okay, for prevention of cancer, there's no supplement that can do that. Okay, so wag aasa for prevention with just a single supplement. Kasi think about this, no? Think about this. If you're someone who is sedentary, you eat junk foods, you have vices, tapos nag-take ka na whatever supplement, magic supplement there, would it be able to prevent cancer? No, because your lifestyle is not good. Okay? So, it still highly depends on the lifestyle, on your lifestyle. So don't just rely on one supplement. Okay, this does not apply to just PPARS Plus, no. All other supplements din. Okay? So, kung may nagbebenta sa inyo na, hey, take this, take that, mape-prevent nyo yung cancer, okay, that's a scam. Okay? You're hearing it here already, ha? So, please don't, wag basta-basta maniniwala because there's no such thing. Okay? Kung meron yan, di sana wala ng cancer, di ba? Okay? So, don't rely on a single product, no, to prevent um cancers. Prevention of cancer largely depends on your lifestyle, how healthy you are, and of course, whether or not you are genetically predisposed. If you are genetically predisposed, nothing much that you can do about it, no? Very limited, but there's still something that you can do about it. So, screening, regular screening for early detection. May tinatawag na prophylactic mastectomy din. If you are BRCA1, BRCA2 positive, no, may mutation doon, then you can consider prophylactic mastectomy. Ibig sabihin ng prophylactic mastectomy, you remove the breast even if the breast doesn't have tumors yet. So it's prevention. It's for prevention basically. Okay? So those are the things that you have to consider, no? So I hope this helped.
It's really in the discipline talaga, Doc. And what I like here is that you jump into prevention na eh. So, do everything na, diba? Alright. Thank you, Doc. Okay. Done na tayo kay ano. Okay. This one. Alright. Wow. Okay. Another question from Christine Banog. Is CA15-3 tumor marker test an accurate test?
Okay, depends on
Good
how
question.
you use it. Depends on how you use it. Okay, ito mga CA15-3 na to, CACA, mga tumor markers na to, with one exception, no? PSA, okay? So all others, it should not be used for screening, okay? It should not be used for screening cancers. Kasi these tumor markers are very non-specific. So by non-specific, it means that there are a lot of things that can influence this it from going up, going down. Okay? So it cannot be used as a screening tool. Now, what if you're diagnosed already? Tapos nagpa-test ka ng tumor markers. So nakita mataas. Okay? Tapos you undergo treatment. So you underwent CA15-3 test again. Bumagsak siya after treatment. Then that's the time that it is useful. The blood tumor markers, no, they are useful to document treatment response. That's it. To document treatment response alone. But it should not be used to diagnose. It should not be used to screen because they are highly non-specific. In fact, I have seen breast cancer patients, no, active ang breast cancer. Advanced, stage 3, stage 4. Nagpa-test ng CA15-3. Normal. Okay? Yung mga ganon.
Oh,
Yes,
okay.
okay. So how can you say that the person is without cancer kung everything else, no, all the other signs points to cancer. Isa lang yung
Obvious
nahiwalay
eh.
si CA15-3. So 'di ba? I mean, come on. So don't rely too much
That,
on these blood tumor markers. No, they are always used in conjunction with other tests and correlated with your clinical picture. Okay?
I see. During the treatment lang, siya best time to be used. Okay. Thank you, Doc. Okay. Coming from Ms. Kiana Luba, very quickly, Doc, can breast cancer spread? Perhaps if you want to explain stage 1, how fast, stage 4, how fast can it spread, something like that, Doc.
Oo. Yes, no. Well, the reason kaya nga cancer, no. So it spreads, no. It has the capacity to spread. Kapag sinabing cancer kasi malignant 'yan. Kapag malignant, then it can spread. Okay, so there are various ways, no, on how cancer spreads. It can spread through the lymph nodes, the lymphatic system. It can spread through your blood. It can spread through your yung side by side adjacent, no, magkadikit, okay? So it can spread through those ways. Now, breast cancer specifically spreads through the lymphatics. That's why we always examine the lymph nodes. Okay? So, yes, breast cancer spreads. So it can happen. So, mag-start yan usually solitary tumor, singular tumor, then it slowly grows. Tapos next thing you know, may nakakapanang kulani doon sa armpit. So itong nakakapang kulani na to, itong lymph node na ito na enlarged, that is where usually breast cancer spreads first. Then later on, magkakaroon na ng kulani dito, just above your collarbone. Typically dito din sa chest, no? That's the next part. And usually kapag kumalat na dito sa may neck, no, sa may chest part, yung iba nagkakaroon ng bukol dito sa dibdib. Then that would be stage 3. Automatic. Stage 3 na yan. Okay? If breast cancer spreads to your brain, it spreads to your bones, it spreads to your lungs, to your liver, then that is stage 4. So, yes. Okay? Confirm na confirm ha, breast cancer can spread. Kaya nga may stages siya. Okay?
That's why also taking action or immediate action is very necessary. Okay, thank you, Doc. Okay, this one have already answered. Okay, coming from Ms. Martesa Merables, I would like to ask, is stage 4 breast cancer has any remedy?
Yes, we have a lot of remedies for stage 4 breast cancer. However, the difficulty here is for you to go into remission. Kasi stage 4 siya, so kalat na yung cancer. Very difficult to put stage 4 breast cancer patient into remission. Yeah, really very, very hard. Not just the medical treatments that you have to undergo, but also financially. Very difficult talaga. There are a lot of things that you have to undergo, a lot of treatment. So it's not just chemotherapy alone or whatever oncologic protocol, no. For stage 4 breast cancer patients, I also use IV vitamin C, intravenous vitamin C treatment. So high doses as well. Kasi at very high doses of vitamin C, they oxidize na. It can kill the cancer cells off, no, by way of hydrogen peroxide, generation of hydrogen peroxide inside our body. So that's the main mechanism of action. Aside from that, minsan kasi hindi pa rin kaya, no. I use ozone therapy as well to just to make sure na the blood flow to the tumor cells are good. Also to help mitigate the side effects of the oncologic protocols and to lessen, if there is pain, no, to lessen the pain. Ozone therapy can do that. Okay, so there are a lot of remedies that we use actually, usually in combination, that we can recommend for stage 4 breast cancer. Okay.
Okay, thank you. On the perspective of our patients and our viewers, just to reiterate, Doc, and clarify, it is still possible for the patient to be in remission and to survive this, correct?
Come again?
Okay. Just to reiterate, on the perspective of our viewers right now, I'm sure they would still want to clarify, even if it's very hard and even if it's very difficult, it is still possible for them to be in remission and also survive stage 4 breast cancer.
Yes, it's still possible because I've seen a few cases, stage 4 going into remission.
Nice. So actions has to be taken talaga. Thank you, Doc. Okay. Another question coming from Ms. Elena Antonio. I was operated last January 13, 2024, stage 2A, and have radiotherapy right after operation. Is that okay? No need for chemotherapy?
Yeah, usually radiation therapy is immediately recommended after, no, usually yan. Chemotherapy depends. If your onco recommends you to undergo chemo, please do so, no. Why it depends? Kasi it depends on what kind of breast cancer you have. Triple negative, ERPR positive, triple positive, HER2 positive. It depends on that, no. So yeah, have to ask your onco if kailangan pa mag-chemo. If ni-recommend niya for you to undergo chemo, please do so. If may ibang treatment naman, hindi chemo, then that's the treatment that you have to go for. Okay? Pero again, if there are additional treatments that your onco recommends you to undergo, yeah, you have to.
Thank you, Doc. Okay, quickly, coming from Miss Malu Carpio, is it normal that I still have pain in my toes and fingers? I finished my chemotherapy and it's been 8 months ago.
Yes, nangyayari yan.
Mm.
Especially with certain chemotherapeutic drugs, no? Ayoko na i-mention yung pangalan kasi baka matakot yung mga tao. Kasi it doesn't always happen, but it does. Now, for this is what we call as peripheral neuropathy, no? For this, ang maisip kong treatment would be, of course, yung PPARs. PPARs kasi it's a very good antioxidant talaga. So it can help mitigate, lessen yung numbness or yung tingling sensation. However, to have a more impactful effect, I recommend ozone therapy and immune drip, vitamin C drip, no? A concoction like that. So we do that in Perpetual Health Medical Center in Las Piñas, in the Integrative Medicine Department. So I would be the one personally monitoring you, checking you out, how you're doing, while you're undergoing the treatment. But yes, there is a chance that you can recover from that, no? Because we have patients in the department that lymphoma patients. At lymphoma patients, ano din yan eh, multiple chemotherapy cycles din yan. So afterwards, nangitim talaga, yung fingers, itim, black, no? Yung iba, ano pa, ano pa ang nails, nagtutuklap yung nails, no? So after undergoing yun nga, ozone therapy, the drips, no? The patients usually recover quite well. And it doesn't have to be expensive. It's actually not that expensive, no? So yeah, definitely these things can help, no? So please set up an appointment para we can schedule you and see how we can help.
Correct. Correct. Thank you, Doc. Okay, once again, for those of you who wish to have a consult with Doc Jansen Kalalan, please, you may just type down how to consult. Miss Beth will definitely get in touch with you individually, or the link for you to schedule an appointment is also in the description box and comment section. Yeah, thank you, Doc. Another question coming from Miss Fatima Bokalid. After a year of LWFT breast removal, my sister-in-law felt growing mass po sa leeg niya. Might be, what could it be, Doc? Another tumor po ba ito?
This might be a lymph node.
Lymph node.
Okay, here are two possible things that I can think of, no? One is, yung left breast was removed. However, upon removing, no, meron ng kalat that went into the lymph nodes dito sa neck. May lymph node dyan. So that's where usually breast cancer cells go to. That's one possibility. That's why, again, it's very important for patients who undergo breast removal to undergo a systemic treatment, no? May it be chemotherapy, may it be whatever oncologic treatment that's systemic. That's one possibility. Another one is another primary. Ibig sabihin, another cancer, not different from breast. Because like what? No, like what? Lymphoma. Yan ang pwedeng tumubo dito sa leg because there are a lot of lymph nodes here. So kapag ang lymph node nagkaroon ng cancer, then that's lymphoma. Okay, so we have two different types of lymphoma which are non-Hodgkin's and Hodgkin's lymphoma. Okay? So definitely no, you have to have this growing mass doon sa neck, have it checked. Okay? Better to undergo biopsy para malaman ano ba talaga yan. Okay?
Thank you, Doc. Okay. We may answer, I guess, 2 more questions before we say goodbye. Okay, because we have a lot of questions tonight. Thank you for pouring in your questions. I know that this is a very good topic kasi, Doc, no? And this is in line with the upcoming breast cancer awareness this coming February 4. So that's why. Okay, thanks everyone. Okay, next question coming from Ms. Nanette de los Reyes. Hi, Doc. Can one with brain tumor take PPARs, at least the tablet form?
Brain tumor, okay lang naman, PPAR tablet, but PPAR tablet, don't expect your brain tumor to shrink, no, with PPAR tablets. You'll probably feel better with PPAR tablets, no, that's about it. But don't expect the tumor to shrink with just that alone. At least extract dapat yan, liquid extract yan. And for patients who have brain tumors, I usually prescribe other treatments aside from PPARs. I also use repurposed drugs. Itong mga repurposed drugs na to, what does this mean, no? There are medications that we use for specific illnesses, di ba? For specific conditions, di ba? So example, no, paracetamol, para saan? Like that, okay? So I use these medications that also has an effect against cancer. Okay? So research has shown that itong mga medications na to that we use for other conditions, no, non-cancer conditions, they have effects against cancer. They target specific pathways doon sa cancer growth. So I use those medications as well to help the body fight the cancer. Okay, so some examples would be metformin. Metformin is a medication for diabetes, for high blood sugar, no, may anti-cancer effect siya. What else? Atorvastatin. May effect din siya against cancer. Okay, in fact, studies have shown that when cancer patients take atorvastatin, no, 15% reduction ang mortality rate nila. 15%. So that's quite a lot, no? Significant siya. And other medications like aspirin, mebendazole, I also use them. Okay? So these are the repurposed drugs. So aside from these repurposed drugs, yun, IV vitamin C, to kill off the cancer stem cells, those are the treatment modalities that we would need, no? If that we would need most often than most of the time, in addition to the treatments, the oncologic protocols, the treatment recommended by the onco. Okay.
I see. Thank you, Doc. Okay. Quickly, another question. Donna, coming from Miss Donna Maclang, my biopsy result showed invasive breast carcinoma. What are my treatment options? Thank you po, Doc.
Depends. There are a lot of treatment options. So kung invasive breast carcinoma ang biopsy, so yan yung ibig ko sabihin. When you get the biopsy under the microscope, the pathologist will only tell you if it is cancer or not, no, based on what we saw. Okay? So itong biopsy finding na ito na invasive breast carcinoma, invasive ductal carcinoma, yan yung description ng cancer na nakita dun sa slide. So to know further, kung para malaman kung ano yung other treatment methods na applicable for you, you would have to undergo immunohistochemical staining, which is yung ER, PR, HER2 status. Okay, so but right then and there, no, when you get diagnosed with this, number one to know, is the tumor resectable? Pwede ba siyang tanggalin? If so, what kind of surgery would you have to undergo? Depends kasi on the stage, no? So staging would have to be established first. Kasi pwedeng mastectomy, ibig sabihin tanggal yung breast pero nire-retain yung lymph nodes. Pwede rin namang tanggal yung breast, tatanggalin din yung lymph nodes. So that's modified radical mastectomy, MRM. Okay? Pwede rin namang lumpectomy lang. Ibig sabihin yung buko lang ang tatanggalin, but i-retain yung breast. So this is what we call as a breast conservation surgery. Okay? Surgeons nowadays, no, depending on the stage nga, no, and the clinical picture, surgeons tend to hindi settle yung yung proper term gravitate yung mas accurate na term. Surgeons tend to gravitate towards breast conservation surgery para at least intact pa yung breast, hindi masyadong magkaroon ng deformity, and if magkaroon man ng deformity, pwedeng i-repair, no, through plastic surgery. Okay, so that's the first step usually. Now, what if hindi pwede ang surgery for a various number of reasons? Number one, karat na yung cancer so ba't mo pa isi-surgery? Number two, masyadong malaki yung bukol. If the tumor is too big, then you would have to also remove a bigger chunk of flesh. So ayaw natin yun. Kasi number one, syempre, may deformity. Number two, blood loss, no? The patient can die on the table. So Prior to the surgery, kailangan paliitin muna yung bukol. By way of what?
Yes.
Systemic treatment. So that would, dyan papasok yung chemo, radiation therapy, and everything else. No? Dyan din ako papasok. Okay? Because I use complementary treatment methods for with the things that yung onco recommends. No? Dyan papasok yung diet as well. So once the tumor successful, na-shrink siya, then remove na yan. So after the surgery, natapos na, depending on the stage again, pwede pang mag-undergo pwedeng i-continue pa yung treatment, yung cancer treatment after the surgery. So that's adjuvant chemotherapy or adjuvant treatment already. Okay? So those are the things that would be possible or that you would possibly would have to undergo, no? So yung post-surgery, dyan papasok yung establishment ng ERPR HER2 kasi if HER2 positive ka, trastuzumab treatment kasi would take a very long time, no? 18 cycles yan usually. Yung iba naman, you would have to just maintain on medications like, for example, targeted therapy like Ibran. Yun, naka-maintenance sa mga pasyente. Yun. So may mga ganyan. So it really depends on what kind of breast cancer that you have. So that's very important. Diagnostics is also important because diagnostics will determine what treatment you would have to undergo.
Thank you, Doc. Very helpful Ang dami pala. Ngayon ko lang na-realize, Doc, ang daming klase ng breast cancer. That is why there are so many modalities and kinds of treatments as well out there. Grabe. Okay, I guess this will be our last question for tonight. Okay, coming from Miss Angelita Clarinates. Doc, tanong ko lang po, ano po ba ang gamot sa lung cancer po? Breast cancer po ako, naka 41 chemo na po. Hindi pa rin nawawala yung bukol sa lung ko. Would it be metastasis, Doc, or just another one?
Pwedeng another one, pwedeng metastasis. Kaya hindi siya nagre-respond eh. It can be a different tumor, so lung primary. It happens, no? It happens. Now, kung lung primary siya, may tinatawag tayo na EGFR mutation. Kapag may EGFR mutation, usually gefitinib, yan ang nare-recommend. I have a lung cancer patient na nawala ang lung cancer mass, no, with gefitinib. But also, of course, no, may mga binigay din ako na additional in combination with gefitinib. We were able to eliminate the tumor in a span of 1.5 months. Stage 3 yun,
Bilis.
Stage 3. Oo, ang bilis, ang bilis. Ngayon, ano na lang, yung scan ng patient is just a cavity. So, wala na. Patient, ano na lang, naka-maintain na lang ata siya ng tablets eh. PPARS tablets na lang ata pinamaintain ko. So, and of course, the patient is still on gefitinib. Pero, patient is quite healthy. Actually, from being, yung oxygen kasi niya, bababagsak talaga, especially when she walks short distances. But now, she can climb up the stairs hanggang 3rd floor. Walang problema. Naging e-bike pa yan. Chinismis sa akin nung daughter. Naging e-bike daw. Pupunta ng palengke, bumibili ng kung ano-ano. So just imagine. So, yeah. So that's one treatment na that can work, no? That might work. However, yun nga lang, syempre, it would have to be established na yung lung mass is not from the breast. Okay? Kasi kung galing siya sa breast, then gefitinib will not work. Kasi breast cancer pa rin siya. Other treatment modalities would have to be considered. So what I do for this treatment protocol ko, no, for cancer in general, I see ko titingnan ko kung applicable ba ang vitamin C drip. Kung applicable, then I go for it. Applicable ba ozone therapy? Ozone therapy is for what, no? Okay, IV vitamin C is to kill the cancer. Ozone therapy is to support the IV vitamin C and to support the body to heal. Okay? What else? There's an immune protocol that I use. So PPARS usually yan. Most of the time. PPARS is maganda talaga in conjunction with the other treatment modalities. However, may scheduling ng pag-inom niyan. So you cannot just take them all at once, no? Kasi may possibility na magkaroon ng interaction. So you would have to discuss it with me. So aside from that, I also use other spices na say for example turmeric, mga teas, no, I recommend those specific foods for cancer, I also recommend those like broccoli, cauliflower, mga garlic, itong mga to, no? So basically it's a combination of foods, no?
Package. Yeah.
Oo, package siya. Tapos I also use yun nga, yung mga repurposed drugs. So that's usually how I approach things. Pero syempre, babalansehin ko pa rin na magiging limiting factor dyan is yung financial capacity ng patient. Kasi kung hindi naman well-off ang patient, syempre, the treatment options that we can do would also be limited. Okay, so aminin na natin. Right? Yeah, that's actually the more, yan actually yung limiting factor na na-experience ko. But nevertheless, these are things that we can do, no? Even if advanced na yung cancer ng patient.
Which once again highlights, Doc, no, the importance that if maybe your condition right now is on the lower stage pa lang, actions is really, really necessary talaga to be done na before it escalates. Okay, naku, Doc, ang dami nating question na answer today, and there are so many questions na pending pa, no? But don't worry, guys, if your questions was not answered tonight, we may ask the questions once again on the next webinar, or we can answer them individually through our messenger as well. Okay? But once again, if you wish to have a consult with Dr. Jansen Kalalan, how meticulous it is, and of course the other help that he can give additional to the treatment that you are having right now, please just comment down how to consult, or the link for you to set a schedule is already on the description box and also on the comment section. Doc, of course, before we say goodbye to our viewers, very quick parting words coming from you. As you know, mix sila ng prevention, ongoing treatment, and survivors as well. So, of course, go ahead.
Oo nga eh. So first, I would like to thank all of you, no, for tuning in tonight. Actually, ang dami nyo ngayon, which is, I'm really happy, no, and the team is very happy kasi we know that we are having a very good impact, especially to cancer patients who really need a lot of help. So I would like to thank all of you for tuning in, for staying with us, and for sa Tagalog, tinatangkilik, no, yung program, no? Because without you, of course, we won't be in existence as well. Okay? And last advice for those of you, no, there are situations it's very difficult talaga kasi if you do this treatment, it can harm your body. If you don't naman, then mag-worsen yung condition. There are certain conditions na ganun. So no worries kasi there will always be options. There will always be things that we can do to help you. Okay? It may not entirely cure the cancer, but at least improve your quality of life. Okay? Which is, I think, is the more important one, no? Especially for cancer patients na very advanced na yung condition. Okay? So, once again, I would like to thank all of you for listening, and I hope you learned a lot tonight. So, thank you, everyone, and Sheila, the floor is yours.
Thank you, Doc. On behalf of our viewers tonight, thank you for answering all the questions, and we look forward to seeing you once again, Doc, next week to answer, of course, some more questions pa. Okay. Thank you, Doc Jansen. Okay, at this point, I'd like to invite everybody for our next webinar. That's next week, and in February 8th, at the same time, Thursday, 7:30 p.m. The webinar is entitled Cervical Cancer Late Stage Protocol. So there you go. If you know anybody who suffer from cervical cancer, please invite them, or please don't forget to like and follow our page, our Simply Nature International Facebook page, for you to be able to be always get updated with our upcoming webinars, online events, and of course, promos as well. Having said that, guys, cold season isn't over yet. So please keep yourself protected and immune system boosted together with your whole family. That's why please get ready for the Super Kilig sa Sulit Tipid Lazada Mega Sale that is happening starting tomorrow, February 2 until February 6. Please check out our participating products in our Last Mall. Don't worry, guys. We are very proud to say this, that we are not only in Lazada, but we are actually in Last Mall. So you can be assured that the products that you order are legit and authentic coming from our office. Okay? Another one, once again, I'd like to invite everybody, those questions that you've asked a while ago, you can ask them face-to-face to our doctors. Not only, of course, Dr. Jansen will be present in our upcoming event this March 16, but we also have our PPARS expert, Mr. Shyan Lim, and also our surgical oncologist, who is also a PPAR partner doctor, Dr. Jimmy Katapia, who will be there present this coming March 16 at SMX SMR. So once again, let me just say this, okay, that we are really calling out to all the cancer patients, survivors, and advocates. Let us all come together to explore the latest advancement in cancer treatment and engage with the multidisciplinary experts dedicated to enhancing your well-being. We intend to answer a lot question during this event. So please, once again, seats are very much limited. And guys, we have heard your request. You can actually now buy your tickets using GCash. Just scan the QR code that you can see here, okay? Send us the receipt, okay, the screenshot of your GCash payment via Facebook Messenger, and we will be the one to reserve the seat for you. Okay, just make sure that when you message us, you put in also your name and your email and also your mobile number so we can contact you. Okay. All right. Now, at this point, I just want to say thank you so much for watching once again our webinar. And we really hope to see you once again in our next webinars to come, because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Good night, and God bless you all.
Hi, this is Shan, and I'm here to update you with a quick teaser. October 14th of 2023, we had our very first post-pandemic face-to-face conference on cancer, and it was a smash hit. The participants loved the ability to ask our panelists of myself, Dr. Jansen, our expert in lifestyle medicine, and Dr. Jimmy Katapia, who's our oncological surgeon, were able to get all the answers they wanted about cancer and whether or not to go for surgery. So we are planning in 2024 another session by popular demand, because everyone wants us to have another one so that they can bring their friends. So a quick teaser, we're going to have back Dr. Jansen, Dr. Jimmy Katapia, so all of you with questions on key surgery, analysts are there, and upcoming guests. Someone who is going to be an expert on diagnosis, something as very interesting like liquid biopsy, all right? So that's something new and on the cutting edge of cancer diagnostics. So those of you who could not make it for our face-to-face, well, this time round in 2024 on March 16th, we're gonna do ours with a Zoom option. So those of you who are in the province who can't join us here in Metro Manila, look out for the details so that you can join us on the Zoomcast.
There's a miracle in this Simply Nature.
Marami po akong natutunan dito sa seminar na ito.
I would recommend it to people who have illnesses, even cancer.
We are always with you from start to healing.